Society places a great deal of emphasis on youth and fitness. A thin shape is often associated with what are perceived to be the most desirable qualities: success, power, and sexuality. However, the pursuit of thinness can become a dangerous compulsion, a condition called anorexia nervosa. Psychologist Dr. David Garner.
Anorexia nervosa is a disorder which involves self-inflicted weight loss, reducing one's body weights to unhealthy levels by dieting and other excessive weight control techniques. It involves substantial weight loss, usually 25–30% of one's previous body weight. It leads to an emaciated appearance that's very, very hard not to recognize that there's something wrong with the person. But the individual who has the disorder doesn't recognize the degree and the severity of their emaciation.
Using excessive exercise, dieting, laxatives, or self-induced vomiting, people with anorexia nervosa constantly try to reduce weight. The causes of the disorder fall into three basic categories.
The first is individual psychological problems, so the problems within the individual, such as low self-esteem, feelings of ineffectiveness, fears of a mature body shape, fears of the expectations that exist with growth and development. Those kinds of things can cause the disorder. Secondly, family factors may be linked to the disorder in that some have identified particular family characteristics which are associated with the unfolding of anorexia nervosa. And finally, cultural factors have been more recently identified as very important and responsible for the very large increase in these disorders over the last 15 years. The pressures on women to be thin are enormous and immense, and the drive on the part of many women in our society to diet is tremendous and excessive, I might point out, and unrealistic.
People suffering with anorexia nervosa are never satisfied with their shape. It is most common among young women, but men can also be affected. The weight loss can be a response to psychological pressures. Once the patient sees the initial response to their weight loss, they perceive it as a way of controlling problems.
Once you see the power you have in actually dieting and some of the remarks that you get, some of the compliments in some cases, you just take it to the ultimate extreme. I guess I always describe it as being possessed, that you have no control over your emotions, over your behavior. You're actually driven to not eat and to avoid any confrontation with food whatsoever.
Laura developed anorexia in her early teens. Now 21, she has recovered and is studying for a degree in psychology. Like many patients, she is very knowledgeable about nutrition. Psychiatrist Dr. Fred Croft.
The anorexic patient is a very intelligent, high-achieving young woman who is very aware of all the different types of foods, their caloric intake, and what makes up a well-balanced, nutritious diet.
I was personally just driven to exercise. I just couldn't sit down. One cracker was just too many. And all I could see were numbers. I mean, I look at car license plates and, 70 calories, well, that meant an apple or whatever. There was always an association to food, as well as I couldn't look at, say, an apple as being, something red and succulent and juicy and you could bite into. It was the number, the calorie count was just all I saw.
The causes are often complex. Social pressures to be thin and an attempt to compensate for low self-esteem can initiate the disorder. A fear of maturing can also be a cause. For some, it is a response to emotional stress within the family. But Dr. Garner feels this is often overemphasized.
In this disorder in particular, the family, and particularly the mother, has been greatly misunderstood and much maligned. I think that parents who have children who have this disorder feel terribly guilty, and in much of their reading, their guilt is reinforced because they are informed that somehow they are responsible for the development of the disorder. And I think it's important to point out that having a seriously ill adolescent in your family causes, I would think, in a normal family, for the family to be quite disturbed and distressed and become overprotective and closely bound together. And the kinds of abnormalities that have been suggested as causal factors may indeed simply be the result of having a very, very ill person in the family.
People with anorexia nervosa often try to hide their condition, and they can be severely emaciated when they are diagnosed. Frequently, the first stage is to treat the physical symptoms by admitting them to hospital to begin to replace the weight they have lost.
The second phase of treatment is really addressing some of the psychological problems or family problems which have been very important determinants of the disorder originally. In general, treatment involves having the person understand that the secret to her own happiness and well-being is probably not going to be weight loss and weight control, but that more complex ways of evaluating herself and understanding herself are going to have to be developed, and that is done throughout the course of treatment.
Treatment may be on an inpatient or an outpatient basis. Through individual counseling and group therapy, doctors attempt to help the patient identify the causes of the disorder and then develop ways of dealing with them. It can be a slow and trying process for the patient and the family. Laura's mother.
It's a very gradual process. I found with my daughter many a time she would progress beautifully in 1 month. But in her case, she was a university student, and when the stress of exams got a hold of her, there would be a relapse. And these relapses in the beginning can be months, they can be weeks, or they can be days.
Each sort of setback is not quite as bad as the previous one, and doesn't last quite as long. But you just have to, that's the only measuring stick you have. That's the only sense that you're moving, if you can reflect back on what previously happened.
It takes years. In our case, it was a period of 8 years. And this, I think, is one thing that, as parents, it's beneficial to know that at the end of 6 months, you know that there's going to be another 6 months.
Our program has a family support group that meets once weekly during the program, but there are other family support groups like the Anorexia and Bulimia Family Support Group that meets approximately monthly for patients and their families to discuss the problem.
For the last 2 years, I've been a member of a support group, and I would highly recommend this. It's a very emotional time, but you'll find that the first time you speak or try to speak, you are very emotional, but the rest of the people there understand.
There is certainly always a risk that this disorder could reoccur. There are relapses in people who've recovered from this disorder. But I think that there is a popular myth about the disorder, and that is that there are no recoveries and no cures. And that clearly is untrue, in that people who receive adequate and competent treatment for anorexia nervosa are able to recover. I feel very, very optimistic about treatment. I think that we've learned a tremendous amount in the last 10 years about treatment techniques. And I think with adequate care generally from people who have had experience in treating the disorders, I think that the likelihood of recovery is very, very good. And I think parents and victims of these disorders should feel very optimistic about the possibilities for complete recovery.
It's always something that remains with you, and you have to accept it as something positive and not to see it as a thorn in your life or a black period, and that you can see it as something, you were faced with a challenge and you met it and you overcame it and you move on to something new. Really, there's more life after anorexia than anyone can imagine.
Anorexia nervosa is a condition that by its increase reflects the attitudes and pressures of the times. Today, Laura is working to educate others about anorexia nervosa. It is a disease that with professional therapy and patience and understanding can be treated successfully.